Okay, so have you ever felt just totally swamped by health advice? One minute it's some miracle superfood, the next it's a natural remedy someone swears by. It feels almost impossible sometimes to figure out what actually works versus what's just, well, really clever marketing. Today, we're going to dig into exactly that. We're unpacking a real question from a listener, Mira, about her varicose veins, and we'll use her experience as a kind of case study for thinking critically about health products. Our guide here is an article by Professor Lin, who responded directly to Mira's confusion.
Yeah, and this is fascinating because it really goes beyond just, varicose veins. It's a perfect example of how advice, even from doctors or pharmacists, sometimes needs a closer look. It's about learning to ask that crucial question. Okay, so what does this really mean?
Right. So let's get into Mira's situation. She was diagnosed with C2, C3 varicose veins. Sounds technical, but basically a mild form, and she wasn't feeling any discomfort. Her doctor suggested an oral remedy, a prescription drug called Daflon. But then she goes to the pharmacy.
That's where it gets complicated.
Exactly. The pharmacist recommended another product, Alvalon, which didn't need a prescription, both supposedly for the same thing.
Okay, so both Daflon and Alvalon, they fall under this umbrella term, phlebotomics.
Hmm.
You can think of them basically as vein-adjusting agents. They get used for issues stemming from veins not working quite right, like varicose veins, or even hemorrhoids, actually.
Gotcha. So what's the core ingredient in these? What are we actually talking about here, and where does it come from?
Well, the main active player in both is something called diosmin. It's a flavonoid, a type of plant compound, and it's primarily extracted from the peels of citrus fruits. Interestingly, there's almost none in the actual fruit pulp. In fact, a lot of the diosmin used in these pills is chemically converted from another flavonoid called hesperidin, which is much more plentiful in those same peels.
Okay, citrus peels, not what I would have guessed. And here's where Mara's digging really uncovered something interesting. She looked into it, even asked ChatGPT, apparently. Found out Daflon needs a prescription in Taiwan, but in the US, it's just an over-the-counter supplement. No FDA approval needed. And Alvalon. Similar story. Imported to Taiwan as something recommended by pharmacists, but again, just another supplement brand over in the US.
Right, and that difference in regulatory status across countries is, well, it's a huge flag, isn't it? How we perceive a product can really change based on whether it's prescription or just on the shelf. And, digging into Alvalon specifically, there's a really clear bit of misinformation right on their Taiwan website. It claims that the diosmin comes from the leaves and flowers of the Japanese pagoda tree.
Wait, but you just said citrus peels.
Exactly. It directly contradicts the known source. It's a stark reminder to, always double-check the claims, even seemingly official ones.
Wow. Okay, so that's one clear issue. What about the difference between the two products themselves? I think you mentioned Daflon is micronized MPFF.
Yes, that's a key marketing point for Daflon. Micronized purified flavonoid fraction, or MPFF. The idea is that making the particles smaller improves absorption.
Okay, sounds plausible. Better absorption, better results, right?
Well, that's where the academic debate comes in. It's quite interesting. You'll find studies, like one from 2020, suggesting that, yes, MPFF might have some advantages in slowing the progression of chronic venous disease. But then you look at a broader 2021 review paper, a meta-analysis, and it explicitly states there's no significant difference in actual clinical effectiveness between the regular diosmin and the micronized form.
No significant difference. So the micronization might not actually matter much for how well it works in practice.
Pretty much. It shows how different studies can point different ways, which is why looking at those big review papers is often so important. No significant difference doesn't mean zero difference, but it suggests maybe not enough to justify a higher cost or prescription status based on that alone.
So wrapping this up for Amara and for anyone listening, what's the bottom line on whether these things work? That 2021 review, even saying no difference between the types, did it find any benefit?
It did, actually. It noted that taking these compounds, diosmin generally, could lead to a noticeable reduction in symptoms, maybe up to 50%. And patients often felt better after taking them for about 1 to 6 months.
Okay, so some potential benefit there.
Yes, but Professor Lind's advice to Mira was still quite cautious. He pointed out that while side effects are usually mild, mostly some stomach upset, there aren't specific clinical trials focusing only on Daflon or Alvalon just for varicose veins. His take was basically, given the low risk, Mira might as well try one of them, but crucially, without any guarantee, it would definitely work for her specific situation.
Right. And what did Mira decide? She really appreciated getting that deeper look. Her words were she felt she had paid too much IQ tax before just accepting recommendations without digging deeper. So she decided to try one for a month, see if she noticed anything, and stop if not. Kind of balancing the cost against that potential but uncertain benefit.
That sounds like a very sensible approach, applying that critical thinking.
It really does highlight how powerful just asking a few more questions can be, doesn't it? Even for something that seems simple on the surface, you peel back a layer, and there's all this complexity conflicting info.
Absolutely. And it really leads to a key question for you, the listener. How do you evaluate these kinds of claims, especially when you see things marketed as natural? Or, like here, when a product's status changes dramatically from one country to another? Or when it's offered for something that isn't actually causing you problems yet? These are often cues to pause, to dig a bit deeper. How can you apply that kind of critical thinking, that questioning, to avoid paying that unnecessary IQ tax in other parts of your life too?
That's a great thought to leave people with. Keep asking those questions. Keep digging into the sources behind the health claims you encounter.